Yeah, there are a lot of features. One that I find very useful is the Rounds PDA companion product. And what that is a PDA, Windows operating system based application that when I'm at the hospital seeing either consultations or doing hospital notes or operative procedures, I can document that procedure, that visit, real time, bring it back, sync it, and build an invoice right away. Whereas before, it was a little piece of paper or a card that was scribbled on, and sometimes my biller could read it, and sometimes it got lost. And if it got lost, then revenue was lost. Revenue doesn't get lost with the Rounds product at this point. When I was looking for EMR product, it was in 2001. I was finishing up my U.S. Army obligation, and I was going to go out solo practice, and I was looking for a product. And I wanted something that was integrated product, EMR and practice management, and there were not a whole lot of products out there. e-MDs and another company, which I cannot remember the name of, were basically what I had kind of looked at. The other company was $65,000 for the software alone, and e-MDs was a whole lot cheaper with training. So it was a very simple decision for me at that point. And I've been very happy with that decision ever since. From a workflow and patient quality of care practice, I think it's been beneficial. We have no charts. When I get a call from Mrs. Jones, I can pull up her chart right away. I don't have to wait until one of the front office people go get Mrs. Jones's chart and have Mrs. Jones on hold, or talk to her not knowing exactly who Mrs. Jones is maybe. I can pull it up and say, this is what your lab results were, this is what we need to do, and document real time that phone conversation. So it's been very helpful in that respect. Well, starting off as a private practice, I didn't have any space to reallocate. And also return of investment is kind of hard to figure out because I didn't have a number to compare it to before. I do know I had a chart audit done a couple years after I'd been using the product, and they came in saying, oh, we're going to be able to make money for you, you'll be able to pay for our chart audit fee. And they found out that maybe I had overbilled $600 instead of underbilling several thousand to pay their fees. And then when we went back and looked at that, we were actually in the right and they were in the wrong. So the software does a very good job in charge tracking and calculations and making money for my practice. The support's been very good. I kind of triage myself. I look at things and say, is this something that I need to get an answer with now? Or is this something I can send an email and I can wait a day or two and get an answer back? And whenever I've needed now assistance, I've gotten it. And the other stuff has usually been within 24 hours, and that's more than acceptable. I can either contact e-MDs by phone, or there's a support forum. And then there is also I think it's a beta site now, but it's where you can submit your issue or your problem, and then it will be directed to the appropriate technician at e-MDs, and they get back with me via email or phone call, and we'll resolve the issue that way. The e-ticket system, that's correct. Recently had an issue with my router, and spent a couple hours with the technician over a few days, and we got my router up and running, doing everything it needs to do with regards to VPN. They've been very supportive. They've been able to assist me with, hey, why don't you try this? It'll help your revenue stream, or and that is more like along the lines of the electronic remittance. This is something that would be helpful for you to get money in faster. The product, when I first bought it, was very much designed for primary care physicians, internists, family practice, pediatrics, and was very limited at that time into what you could do with the templates. The template editor has made that much, much better. I can now design a template that fits exactly what I want. Further, the product comes with templates pre-packaged with it that any general surgeon should be able to pick it up and start using it. They may not like exactly how it says something, but neither do most primary care doctors like exactly how the templates say something. So we're always going to have to do a little bit of editing, but I think it's very well adaptable and comes ready to use for general surgical practice.